The American Academy of Pediatrics is urging parents to, quote, get their youngest children vaccinated for COVID. Of course, Trump's handpicked health secretary, Robert F. Kennedy Jr., who has no medical experience, he says healthy kids no longer need a COVID vaccine. But the doctors group, the American Academy of Pediatrics, is publicly recommending that all kids, all people ages 6 to 23 months, receive a COVID vaccine. And while the federal government fails and falls apart under Trump's watch when it comes to public health, individual states are now starting to take matters into their own hands as best they can. They're picking up the slack in terms of the governance on this issue. In Illinois, Governor J.B. Pritzker's health department is reportedly exploring the possibility of bulk purchasing COVID-19 vaccines straight from manufacturers. The New Republic's Greg Sargent reports that a coalition of states led by Massachusetts Governor Maura Healey is planning to coordinate on the purchase and distribution of pediatric vaccines should the federal government restrict access to them. Massachusetts is also requiring, as a state, they're requiring that health insurers cover vaccines recommended by the state, regardless of what Kennedy's corrupted CDC recommends. On the West Coast, Oregon, California, Washington, and now Hawaii have formed a public health alliance on the West Coast to provide vaccine guidance, given the Trump administration dismantling the elements of the CDC that responsibly used to do that. The governors of those states argue that the CDC has, quote, become a political tool that increasingly peddles ideology instead of science, ideology that will lead to severe health consequences. We will not allow the people of our states to be put at risk. A growing number of democratically led states, blue states, are taking action because they need to. And it's not just the West Coast. It's not just Illinois and Massachusetts, also New York, also now today, blue state, Minnesota, Governor Tim Walz signing an order to help people in his state get the COVID vaccine. All these action in all these states will have a tangible effect on the lives of people who live in blue states. Blue states are forming coalitions. They are each doing what they can to start governing on public health as the Trump administration stops. How much can blue states do on their own? And what type of dynamic does this create in the country when we have red state science and blue state science and infectious and communicable diseases in the middle of it? On Friday, the Washington State Health Department's chief science officer signed a standing order for the COVID vaccine, which should allow most residents of Washington state to be able to go directly to a pharmacy or a clinic to get a COVID vaccine without an individual prescription. They're trying to rationalize this in Washington state to make it easy to get a COVID vaccine if you want one. They have to do that on the state level because the FDA, under Trump Health Secretary Robert Kennedy, just slashed its federal recommendations of who should be eligible to get the vaccine, leading to both bottlenecks and confusion nationwide for people who want to try to get one. In signing this new order, Washington State's chief science officer said this. He said, "We want to ensure all Washington residents have access to the protection these vaccines provide based on the best available science." Yes, that's a radical thing to say these days. Joining us now is the Washington State Department of Health's chief science officer, Dr. Tao-Hsing Kwang-Get. Dr. Kwang-Get, thank you so much for joining us this evening. I appreciate your time.
Oh, thank you so much for having me.
Let me ask about the decision of your state to join with some other states on the West Coast, this West Coast Health Alliance, to try to work together on vaccine issues. Why have you done that, and what do you anticipate doing in this new compact?
Well, there have been federal changes that have introduced a lot of uncertainty and confusion for people around vaccination and COVID-19 vaccination. And so the governors of our states, California, Oregon, Washington, and then joined by Hawaii, created this alliance to really elevate and affirm the really important public health value that public health policy is best when it's based on science.
In terms of vaccination, obviously, there's a public health component to this, not just an individual health component. These are communicable and infectious diseases that we are talking about, and the overall vaccination level in the community matters in terms of how big epidemics and outbreaks can get. Is it smart for individual states who may have differences with the federal government on these things, to join together rather than doing this on their own. We're seeing what you're doing on the West Coast. We saw Minnesota take some similar steps. We've seen Massachusetts take some similar steps, some other states in the Northeast talking about it. Is a larger group of states a better approach, given that it's a public health matter that applies to hopefully as many people as possible?
One thing that's in common with the actions of all of the states that you just mentioned is that their actions really aligned at making sure that COVID-19 vaccine policy is based on the best available science. And it's true, there are concerns by many in public health that there will be a variety of different recommendations throughout the country, state by state or region by region. And that's why those of us in the West Coast Health Alliance, and as well as many in other states, really have focused on the recommendations of trusted national organizations like the American Academy of Pediatrics, like the American College of Obstetrics and Gynecology, who have a long tradition of establishing very solid science-based vaccine recommendations for people. So by citing these national and well-trusted associations, we're hoping to avoid some of the fragmentation that many fear.
Given the sort of chaos and changes at the federal level, is there any reason to be concerned about whether there will be sufficient vaccine to procure by states or by any other means for enough Americans who want to be vaccinated?
That definitely is a concern. And even now we are hearing that people are having difficulty getting access to COVID-19 vaccine because of supply issues. And this is not unusual. Oftentimes when there's a new vaccine available, we go through a period where supply isn't where we want it to be. But we're hearing from ordinary Washingtonians that they were having difficulty getting vaccinated because some pharmacies were asking for a prescription from a healthcare provider, which is an extra step that they didn't used to require. So that's when we realized that a statewide standing order, which is like a prescription, except instead of signed by your doctor, it's signed by me as state health officer, that a statewide standing order could be a prescription that will make it easier for people to get access to COVID-19 vaccine.
Dr. Tao-Cheng Quanget, the Washington Department of Health's Chief Science Officer, thank you. And thank you for your clarity in explaining that at a time when a lot of people, I think, are confused about what's going on. Thank you, sir.
Thank you for having me.